In this presentation, we will be seeing about blood clotting mechanism. From this portion, essay questions, short essays or write briefly questions may be asked. This is a previously asked essay question. Look at the question. A 12 years old boy had a swelling in the knee joint after a small injury. His clotting time was 12 minutes. Answer the following. What may be the probable diagnosis and what is its cause? Explain the clotting mechanism in detail. Mention and interpret the tests for assessing bleeding and clotting time and the role of vitamin K in clotting. Coming to the first question, what may be the probable diagnosis and what is its cause? The probable diagnosis in the given scenario is hemophilia. The given clues are there is a history of hemarthrosis, that's bleeding into the joints after a trivial injury. Also, the clotting time is prolonged. Hence, the probable diagnosis is hemophilia. It is due to the deficiency of clotting factors which leads to impaired coagulation. In hemophilia A, there is a deficiency of clotting factor 8. In hemophilia B, there is deficiency of clotting factor 9. And in hemophilia C, there is deficiency of clotting factor 11. This slide is about hemophilia A, as this may be asked as a separate question also. So, hemophilia A is characterized by bleeding tendencies associated with increased clotting time. It is due to the deficiency of factor 8. It is an X-linked recessive disorder in which males are affected and females act as carriers. So, investigation wise, there is a normal platelet count and bleeding time, whereas there is prolonged clotting time, and the definitive, that is the investigation to confirm the diagnosis, is by doing a factor 8 assay. The treatment for hemophilia A is blood transfusion or transfusion of cryoprecipitate. The definitive treatment is a transfusion of factor 8. This slide shows the names of various clotting factors. Factor 1 is fibrinogen, factor 2 is prothrombin, factor 3 is thromboplastin, factor 4 is calcium, factor 5 is labile factor or proaxlerin, factor 6 does not exist, factor 7 is a stable factor or proconvertin, factor 8 is antihemophilic factor AHF or antihemophilic factor A, factor 9 is Christmas factor or antihemophilic factor B, factor 10 is Stewart-Prower factor, factor 11 is plasma thromboplastin antecedent PTA or antihemophilic factor C, factor 12 is H-band factor or glass factor, factor 13 is fibrin stabilizing factor. HMWK refers to high molecular weight kininogen. Ka refers to kallikrein. PL refers to platelet phospholipid. Coming to the next question, just to explain the clotting mechanism in detail, there are three main stages. Stage 1 is the activation of factor 10. So, activated factor 10, 10A, is referred to as prothrombin activator. So, the first stage is formation of prothrombin activator. It occurs in two pathways. One is the intrinsic pathway and the extrinsic pathway. Stage 2 is the formation of thrombin from prothrombin. Stage 3 is the formation of fibrin from fibrinogen. Now let us look at the clotting pathway in detail. So as we saw, the first step is the conversion of factor 10 to factor 10A. Factor 10A, activated factor 10A is prothrombin activator. So it occurs by two pathways, that is extrinsic pathway and the intrinsic pathway. So the trigger for intrinsic pathway is a contact with negatively charged surface or exposed collagen of the injured vessel. These are the two triggers for intrinsic activation of intrinsic pathway. Next is the extrinsic pathway. The trigger for the activation of extrinsic pathway is that it is the release of tissue thromboplastin from the injured tissue. So coming to the intrinsic pathway, first step is the activation of factor 12. Factor 12 is converted to activated factor 12A. This activates factor 11 to 11A. Activated factor 11 converts factor 9 to activated factor 9. 9A converts 10 to activated 10A. So each step has various cofactors that help in the process. So in the first step, high molecular weight kininogen and kallikrein act. In the second step, high molecular weight kininogen act. Third step, there is calcium also helping in the conversion of factor 9 to factor 9A. Then factor 8A along with platelet phospholipid and calcium along with activated factor 9 converts factor 10 to factor 10A. So this is the intrinsic pathway. Coming to the extrinsic pathway, so there is release of tissue thromboplastin which converts factor 7 to factor 7A, and this will convert factor 10 to 10A. Now the first step, as we already know, TPL, that is tissue thromboplastin, converts the release of tissue thromboplastin converts factor 7 to 7A, and also in the next step, platelet phospholipid, tissue thromboplastin and calcium act. And also, if you can see, factor 7A also speeds up the conversion of factor 9 to 9A. So from this we can understand that intrinsic and extrinsic pathway are interlinked. So this is the stage 1 of the clotting pathway, that is formation of factor 10A, activated factor 10, prothrombin activator. What does this do? This will convert prothrombin to thrombin in the presence of platelet phospholipid, factor 5A and calcium. Now this thrombin will convert fibrinogen to fibrin. This is the third step. Also, this thrombin will go and convert factor 13 to 13A, and this is a fibrin stabilizing factor which stabilizes the fibrin that is formed. That is, the last step has 3 stages basically. There is proteolysis of soluble fibrinogen, polymerization of the fibrin monomers, and there is stabilization of the fibrin polymer. So these are the steps in clotting mechanism. So the next question is to mention and interpret the test for assessing bleeding and clotting time. First, coming to bleeding time. Bleeding time is the interval between the moment when the bleeding starts and the moment when the bleeding stops. So there are 2 methods. One is the Duke's method. The normal bleeding time by Duke's method is 1 to 4 minutes. Next is the IV's method. The normal value by IV's method is 2 to 7 minutes. So bleeding time is prolonged in purpuras, but it is normal in coagulation disorders like hemophilia. Next, coming to clotting time. Clotting time is the interval between the the moment when the bleeding starts and the moment when the fibrin thread is formed. There are two methods. Capillary tube method, the normal value of clotting time by capillary tube method is 3 to 10 minutes. The other one is the modified Lee and White method. And clotting time depends on the availability of coagulation factors. In hemophilia, clotting time is prolonged. Also, clotting time is prolonged in vitamin K deficiency, liver diseases, and overdose of anticoagulants. This slide is just a word about PT and APTT. So PT, prothrombin time, assesses the extrinsic pathway. APTT, activated partial thromboplastin time, assesses the intrinsic pathway. Coming to the next question, which is to explain the role of vitamin K in blood clotting. So dietary vitamin K and vitamin K synthesized by the bacterial flora is absorbed from the gut and it reaches the liver. In the liver, the synthesis of factors 2, 7, 9, 10, that is prothrombin 7, 9 and 10, is dependent on vitamin K. So vitamin K is actually required for the post-translational gamma carboxylation of the vitamin K dependent factors, that is factors 2, 7, 9 and 10. So if you look at this picture, you can draw this representative figure showing the role of vitamin K in blood clotting. Inactive factors 2, 7, 9 and 10 in the presence of gamma glutamyl carboxylase is converted to activated factors 2, 7, 9 and 10. So when this is occurring, vitamin K in the reduced form is converted to vitamin K epoxide form. And this epoxide form, in the presence of vitamin K epoxide reductase, it is converted back to the reduced form. Now warfarin, which is used as an oral anticoagulant, is vitamin K antagonist. So that's about it. Thank you.